Good afternoon and welcome to today's Inclusion Connects Community Advisory Committee meeting. Before we get started, here are a few reminders about the webinar. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call, unless you're speaking or asking questions. To ask questions, use the Q&A feature located on your control panel, and we will answer as many questions as time allows toward the end of the presentation. American Sign Language interpreters for today's event is Danette Stillman Bridges and Ernest Williams. Closed captioning options are available. For closed captioning options, select the closed caption feature located on your control panel. To adjust your video layout and screen view, select the View feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda Today's agenda includes an overview of Inclusion Connects, program updates, the Inclusion Connects quarterly report, NCI state workforce results, DSP training courses, and updates on the DSP pilot program. There will also be time for questions after the presentation. At this time, I'd like to turn it over to Tina Barrett, IDD Assistant Director for IDD, TBI, and Olmsted Section of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Good morning, and thank you for joining us today. My name is Tina Barrett. I am also joined today by Lauren Spencer, who is one of our IDD consultants with the Division of Mental Health, Developmental Disabilities, and Substance Use Services. Claire Colligan, who was scheduled to be with us today, is not able to join us. So I will be covering some of the Inclusion Works topics that she would have normally been covering for us. Next slide. So as a quick reminder, and thanks to everyone for joining us today, Inclusion Connects is the North Carolina DHHS program to connect people with IDD to more choices and more access to services and supports. It has been designed to help people with IDD, regardless of age or ability levels, and their families navigate the complex systems of services from birth to the end of life. We're working very hard to be focused on identifying what people need and connecting people to the services to best meet those needs. We have 4 topics, 4 areas that we have spent a lot of time working. Actually, we have 5, apologize for that. So we focus on strengthening the direct support professional workforce, and we'll be talking more about that a little bit later. Promoting access to services, and Lauren will be sharing some of the work that's happening in that space and some of the things that are going on. We also have improving community access and housing. We also have strengthening the interpersonal violence supports. We will not be giving an update in that space. However, I do encourage you to go to the Inclusion Connects website. There is a lot of information there, different topics and areas, and also the webinar that was hosted in March is available there as well. And Inclusion Works, which is our competitive integrated employment program, helping connect people to work opportunities. Next slide, please. The Inclusion Connects work plan has recently been updated and has been posted. It was originally posted in March of 2025, is updated in March of 2026. There is a link there. I encourage folks to go and take a look at what we have there. It is our strategy to improve services for people, and it outlines the different metrics and targets that we use to help do that and measure the progress that we're making. Next slide. The Inclusion Connects Advisory Overview, our meeting schedule is here on this slide. As you can see, we've got today's meeting, and then actually through January of 2027, these are quarterly meetings. The registration link is also available. It's the same one that you used today. We encourage you to respond to the calendar invitations. Please come prepared with questions and ideas about the different programs and what's available. And if at any time you want to know somebody who wants to be more involved or who is interested in having more information, if there are topics that you would like to have added to this meeting, please reach out to me. I can be reached at tina.barrett t.l.barrett@dhhs.nc.gov, and my email is on there as well. We do encourage everyone from our community to be involved. Next slide. We also have our Inclusion Connect advisory committees. Please use the QR code to be able to participate and sign up to be part of those. We do have the community living, which focuses on the in-reach diversion and transition work. We also have access to services, as well as our DSP workforce. We also have the Inclusion Works advisory committees, and we also have an interpersonal violence advisory committee. Our tailored plan work group is one that we do have set up so that we can connect with our tailored plan partners and talk through different initiatives, especially those that are involved with the tailored plans. Next slide. Inclusion Connects and Inclusion Works updates. So we're going to go ahead and launch into the meat of this. So what's new for the spring of 2026? The 2026 NCI State of the Workforce Survey has been sent to all eligible providers. Please reach out to NCI survey at dhs.nc.gov if you have any questions, or if for some reason you feel like you should have gotten a link and you have not gotten one. That is for the next iteration of the NCI State of the Workforce. So we encourage everyone to be involved with that. We're also celebrating Autism Acceptance Month. So we encourage folks to join us in our upcoming webinar with the Autism Society of North Carolina. That will be on April 23rd. I do believe that there is a link at the end, as well as I think Carol has dropped something in the chat for us. We're also encourage everyone to participate in the Include NC Planning Tools Survey. That is going to be working to strengthen emergency preparedness for people with IDD across the state, and to be able to ensure that in the event of an emergency, folks are in fact prepared and have the tools that they need. We're going to read our quarterly report and report summary to see how we're enhancing access and supports. I'm going to review the quarterly report summary. However, the report itself is available on the Inclusion Connects worksite that was recently posted on April 15th. Next slide, please. So we also have some inclusion work updates and what is new for spring. The second round of the Provider Innovation Grant applications did close on April 15th. Applications are now being reviewed. So a special thank you to everybody who applied for those. We're really excited to see the positive response that we've gotten, and we're looking forward to being able to announce the recipients of those. We did have a lot of positive response from round one, and so we're really excited to be able to extend it into round two. There is a new informed choice video that is available on the North Carolina DHHS YouTube. There is also a link in the Inclusion Works website. Great video if you have not had a chance to look at it. There's also special events that are being held in April in honor and recognition of Autism Acceptance Month. There was a lunch and learn on April 15th led by Mike Chapman from UNC Teach, and that recording has also been posted on the Inclusion Works website. There's a link there. And there's a social media campaign with Work Together North Carolina that will be beginning soon. So a lot of good things happening in the Inclusion Workspace as well. Next slide. Okay, so now I'm going to launch into some of the key findings from our April 15th report. So I'm going to take a few minutes and let's talk about the data summary that we have in place. The Inclusion Connects quarterly report does cover the period of October through December of 2025, and the full report is posted on the Inclusion Connects website as of April 15th, 2026. Inclusion Connects is the North Carolina Department of Health and Human Services program that connects people with intellectual and developmental disabilities to more choices and more access to services and supports. This program is a collaboration amongst North Carolina DHHS divisions, including the Division of Mental Health, Developmental Disabilities, Substance Use Services, Employment and Independence for People with Disabilities, and Medicaid to provide resources for connecting people of all ages and abilities with IDD to the services and supports that make it possible for them to live, work, and thrive in their chosen communities. Inclusion Connects focuses on improving access and enhancing the housing array for people with IDD, promoting access to services for people in need of services, including those who are on the Innovations Waiver waitlist, addressing the direct support professional or DSP workforce shortage, and supporting competitive integrated employment through Inclusion Works. One of our main focuses is access to community living. As part of the report, we report on InReach, transition planning following InReach, and diversion from institutional settings. Institutional settings include intermediate care facilities, or ICFs, including the 3 state developmental centers, psychiatric residential treatment facilities, or PRTFs, adult care homes, or ACHs, and other institutions. Next slide, please. InReach is the act of intentionally and purposefully educating people with disabilities in an institutional setting and their legally responsible person on the benefits and services available in community-based settings. While this is done primarily in person, it can also be done by telehealth and other communication methods like phone calls or emails. It also provides opportunities for meeting other people who live in the community. The purpose of InReach is to provide information and education for the person and their family and supports to make it the best, most informed decision for their individual circumstances. InReach processes are in development to standardize the frequency and informed decision-making process for all people in institutional settings. This quarter, we saw a slight decrease in both face-to-face and non-face-to-face InReach from the previous quarter. Rates of people in institutional settings also decreased slightly. It's important to note that there's no expectation for the number of people who receive InReach to increase over each quarter due to the current lack of standardization across the plans. At this time, reports indicate people receive InReach typically annually. We expect people to receive InReach regularly because people's needs and the system changes over time. For example, 5 years ago, there were no 1915I supports. So if you did not have the Innovations Waiver, there were really very few other options for services. With the addition of 1915I services, we want to make sure that people know what choices they have as are potentially available to them. Next slide. This slide shows data related to the number of people who choose to participate in transition planning or moving after they receive InReach. There are currently 108 people, or about 28%, participating in moving planning after receiving InReach. Community settings look different for different people. This could mean living in a house or an apartment with friends, living in a house with family, living on their own, or any other number of types of living situations. For those who didn't choose to move, it could be for a number of reasons as well. They may have lived in their current location for the last 20 years and consider that home. They may need significant medical or behavioral supports that they don't believe can be duplicated in a family or community setting. The goal is to ensure people understand what is possible, what is available to them now, and ensure that they have the information they need to make the right decision for their current situation. Next slide. This slide shows data on diversion and transitions. Diversion involves identifying people with IDD who may be at risk of moving into an institutional setting and connecting them with services they need to stay in their own home and neighborhoods. This may mean linking to 1915I services, mental health services, other possible waivers, or other state programs. When you look at the orange line, you will see we saw a decrease in those who were diverted in the reporting quarter. And this represents the first report that was submitted using the standardized definition of diversion eligibility. We do expect some variations as the plans continue to work on identifying those members eligible for and participating in diversion. This chart also includes the number of people who moved out of institutions. It's represented on the blue line. We expect to see this number fluctuate over time as waiver slots become available and people indicate the desire to move. So as I mentioned earlier, there are more services available now than ever before, including the 1959 services, state-funded services, and other possibilities that are not specific to people with intellectual and developmental disabilities, but are available to meet people's needs. The waiver is still available, but there's a tremendous wait list that continues to grow. Next slide. So as I mentioned, we do monitor the number of people who are on the wait list and those who are receiving IDD services while they wait. The Innovations Waiver is a program that allows for an array of IDD services to be provided in the home and in the community. For years, this was the primary source of services for people with IDD. The Innovation Waiver relies on allocation of slots from the General Assembly. So there are some years where we get slots allotted, and there are some years that we don't. For the most part, we continue to rely on vacated slots to bring people onto the waiver. People vacate their slots for a variety of reasons. There are some people that may move out of state, may move into an ICF or other institutional setting, or they may pass away. Or in some circumstances, they may feel that they no longer need the slot, or that they no longer need those services to meet their level of care. As you can see on this slide, there's currently 20,893 people on the wait list as of December 31st, 2025. Next slide. As I mentioned, there are a finite and additional slots must be allocated by the General Assembly. Next slide. Currently, there are 14,736 total waiver slots. As of December 31st, 2025, there were 14,161 slots being actively used. So that means there is a person assigned to that slot that is receiving and also billing for services. There are 486 inactive assigned slots and 89 remaining reserve slots. Reserve slots are those slots that are reserved each year for military transfers, emergency slots, transitions from the Community Alternative Program for Children, which you may hear referred to as CAPC, and Money Follows the Person, which you've probably heard referred to as MFP. MFP is a program designed to support people who choose to move out of institutional settings and into the community. An inactive slot has a person assigned that isn't billing against it. This sometimes happens if someone is new to the Innovations Waiver, since it can take 90 days to enroll, especially if the person is going through disability determination. They've temporarily entered an institution, like what could happen if a person has surgery and needs to go into a skilled nursing facility for rehab, or if a person has passed away. Inactive slots are not reassigned until the beginning of the fiscal year. Next slide. But again, there are services while a person waits for an innovation waiver slot. And for many people, the 1915I service options may meet their needs to live at home and in their neighborhood. During this reporting quarter, we noted 9,662 people, or close to half of the people on the wait list, were able to access an IDD service while they waited. We're really excited to see that number increasing. There are more details on the Innovations Waiver Waitlist dashboard, including demographics, other services that are accessed, wait time, and looking at the number of people with Medicaid. One thing we noticed, there are significantly more people with Medicaid than the number of people accessing IDD-related services. All of this data and those discrepancies are used to help guide program design and service implementation. Next slide. So while we're interested in the services people are accessing while on the wait list, we also want to increase access to 1915I for all eligible people with IDD. 1915I is inclusive of community living and supports, respite services, supported employment, and community transitions. Tailored care management is not a 1915I service and is not included here. During this quarter, we saw an increase in the number of those who received 1915I services, and there was a decrease in the number of assessments completed and approved. However, that may be due to seasonal fluctuations related to the holidays and is something we will continue to monitor. So just because someone has an active authorization or bills a single unit in a quarter, that does not indicate true access. We can authorize all sorts of hours, but there's not a direct support professional to work those hours. Then are we really addressing access? Next slide. So, in order to monitor workforce health, we look at the number of community living support hours authorized versus the number of community living and support services that are actually billed. We set a utilization target of 85%, which means that we want to see people using 85% or more of the hours they're authorized for. This number is set at 85% to allow for vacations and time off, since people do get sick and they have their own personal emergencies or they have emergencies with their own families. As you can see for this quarter, next slide. As you can see for this quarter, VIA and partners both exceed, nope, sorry, go back. VIA and partners both exceeded the target of 85%, while Alliance and Trillium were below the target. We continue to work with our tailored plan partners to understand what the possible barriers are to hitting the target, but also to learn from the successes in those tailored plan areas where the target is being reached. Next slide. For the first time, we've included a chart to start looking at trends based on authorized units not being provided due to the lack of staff availability. We want to recognize the efforts of our partners at the tailored plans and the providers who work to provide high quality data. We encourage learning from each other to support people with intellectual and developmental disabilities across the state and recognize that there are some amazing innovations that are being implemented to help support people with IDD. Next slide. So I'd like to turn it over to Lauren Spencer to give an overview of the Innovation Waiver Waitlist dashboard updates.
Good morning, y'all. It's nice to be chatting with y'all again. So we have been able to update the Innovations Waiver Waitlist dashboard with information and data related back to the same quarter Tina has been talking about all along. There are no new features this quarter, so it should look pretty similar to previous iterations, barring some of the data. So as Tina had previously mentioned, we do continue to see the total number of people on the Innovations Waiver waitlist grow. So we are currently just shy of 20,900 people waiting on an Innovations Waiver slot today. We do, however, continue to see things remain relatively stable in that we see far more males waiting for a slot than females. The average age has stayed the same, and we do see that autism spectrum disorder is still the most commonly listed diagnosis as a need for this service. Next slide, please. We were also able to update the average amount of time that folks have spent on this wait list that are still currently waiting. So this does not include people who have previously been offered a slot and have chosen to remain on the wait list, but not move into that spot. And it also does not include people who have had several attempts to reach out to them to offer a slot. But this information, generally speaking, is very similar. It is still at, if you rounded slightly, at 5.8 years on average across the whole wait list. Next slide, please. And finally, again, pretty similar information here as far as services that are being accessed by our folks who are waiting on an Innovations Waiver slot. We do see that the number of services that are being received on average by people receiving services has stayed the same at 2. And there's still 81% of people on the wait list who have Medicaid from this past quarter. The thing that we do see, however, is that there are more people, more absolute people who are receiving services. So we see an increase in the total number of people receiving any kind of service, in addition to an increase in the number of people who are receiving IDD-specific services, which we're really excited about. Next slide, please. As we're also really focusing on our DSP workforce, we did want to talk about the NCI State of the Workforce results that are most recently published, so from 2024 results. As we can see here, there are quite a number of provider agencies who are providing direct support professional services to adults with IDD through Medicaid funded services, which are the providers who were eligible to participate in this survey. And so we saw 126 of those providers participate. We see that those services are provided in a number of different places, including residential, in-home, and non-residential locations. We also see here that we are seeing that the people who are more likely to stay, so our DSPs who will remain in their positions, are folks who have already been in those positions for 3 or more years. And we're most likely to see turnover in positions that are being held by new employees, so folks who have been there for less than a year. We are excited, however, that we have seen a slight, but still a decrease in the average turnover ratio from 27% last year to 24% this year. Next slide, please. We also know when it comes to DSP workforce that wages are always a really important part of that conversation. So if you look at the top left bar graph, you'll see those light bars or columns represent North Carolina, and the darker ones are the national data. So we see that North Carolina's median hourly wages for DSPs does continue to come under that of the national median. However, we do also see that year over year, there has been an increase in the average median wages for those DSPs. We do still have some work to do, as you can see on the right-hand side in that big red box that shows that while North Carolina does have some increasing wages, we still have about $6.78 to go per hour before we will reach that living wage that this chart is showing. So still some work to do. Next slide, please. And we did want to look at what are some of the ways that provider agencies are looking at and assisting with recruitment and retention of DSPs. So as far as recruitment goes, we do see that the majority of agencies are offering a realistic job preview, that are about a third are offering some sort of monetary incentive or bonus as a part of those recruitment efforts, and that agencies are recruiting from high schools or colleges, and about a third of those providers that responded. There are also a number of ways that agencies are looking to try to retain DSPs, including recognition programs and engagement surveys to try to help better understand what DSPs need. And we did also see that there was a decrease from about 39% to 33% of provider agencies that turned away new referrals or stopped accepting new referrals because of staffing issues, which we are also interpreting as that agencies are having an easier time filling those staffing needs. And I believe, Tina, I'm turning it back over to you. Next slide, please.
Thanks. Appreciate that update, especially as we lead into talking about the DSP Advanced Training courses. Next slide. So the DSP Advanced Training Spring 2026 courses are currently underway. They have been ongoing since March. They continue to follow the same format as we have had previously. And the participants who complete both of the 8-week online courses can have those credit hours turned so that they count towards an associate's degree. So that is part of the broader state effort to address the DSP workforce shortages, help improve wages, training, and career pathways. So there's some link and information there for the community colleges. If anybody is interested, we do expect those to also be available in the fall of 2026. Next slide, please. An update for folks so that they have a better understanding of the training. We are looking at a continued success with our partners. We had 79 people that were enrolled in the 3 fall 2025 courses, and 47 people completed those courses. So we did stop for a minute to look and see why did we not see a higher percentage of people completing. And our partners at the community college did reach out to folks, got more information about them, As a result of that, we did add a synchronous course for those folks who maybe have found it a little bit harder to go back to school because it's been a while since they've been in school. That can certainly be very challenging. And to be able to help support people as they are getting back into the college scene. And currently for the spring of 2026 courses, we do have 120 people that are enrolled. And I believe that 20 of those people would be eligible to complete both the first and second course at the end of the spring training. So we're excited to be able to start seeing people rolling out of that, and we're looking forward to see the bigger impact as we move forward. Next slide. So we also have 4 pilot programs that we have been monitoring and supporting. Next slide. Specifically around those, we did support a pilot program with OE Enterprises, which was around an LMS training platform pilot for them. That was actually started in November, and there's an overwhelming positive response to the DSP orientation training with a 4.5 out of 5 for higher preparedness, engagement, relevance, and overall experience using the training platform. There's some additional analysis that's underway to address whether that impacts DSP retention in that space. Horizons also has a DSP mentor and mentee pilot that is underway. During the first quarter results, there were 6 DSPs that were hired and rewarded a 90-day employment bonus. And half of those participating DSPs are still employed. So we're waiting for quarter 2 data to get more insight into what's going on there. And those are also very preliminary results, and it is a very small sample size. Bayada has a HabTech induction pilot program where they are providing a paid orientation wage at $10 per hour to all of the induction training participants. The pre-implementation data did show strong retention at 91%, and that has been consistent during implementation thus far, with 91% retention reported in quarter 4 of 2025. So we're looking to get more data there as well. And then the Carolina Center for Autism has an RBT cancellation pay pilot. And one of the things that has been noted is that there's a significantly lower turnover rate, as noted by stable hours and guaranteed pay, driving a lower turnover in full-time RBTs. They're seeing a rapid growth of a stable workforce since they transitioned primarily to full-time RBT workforce. That has changed from 21% to 82% since January of 2024, and it's reduced the reliance on part-time staff and improved their workforce continuity. So, and RBTs are reporting higher overall job satisfaction as well. Next slide. Okay, so a couple of things that are coming up. We do have some webinars and presentations coming up. I think I mentioned before, April 23rd, we do have After the Autism Diagnosis, delving into some effective treatments and teaching methods. We're really excited to be able to have the Autism Society joining us on the 23rd to be able to present that information. We also moved the side-by-side for April, and so that will be on April 27th and has a focus on autism spectrum disorder as well as Autism Acceptance Month. I think the details on that, not a secret. Lauren, I don't know if you have anything to share, but we're really excited to have a variety of topics for that.
I don't think I have anything really specific to share today, but we are excited to hopefully highlight some things that are going on at each of our LME and COs that they have been doing so well.
Great, thank you. And then, of course, upcoming, we do have side-by-side scheduled for May 11th, June 8th, and July 13th, and those topics are as yet to be determined. I'm also very excited to announce that we are going to be hosting a webinar around permanent supportive housing and the targeting program for people with IDD. We will be joined by Angela Harper King and Deetra Purcell, who will be presenting that information, and that will be June 24th. I don't know that that link is yet available. I'm guessing it is because it's a purple line. So we're very excited to be able to be presenting that in June. I think that's one of those areas that we don't necessarily always have an opportunity to present. So we're looking and continuing to focus on different priority areas for Inclusion Connects. And again, our focus is on that education around housing options, strengthening the DSP workforce, and then also expanding access to services, both for people with IDD and also for the vocational opportunities. So next slide. I think, oh, okay. So contact information, always important. On the right-hand side of this slide, you do see the LME MCO contact information. Their phone numbers and websites are there. So we encourage you to reach out to your LME MCO for support. And also part of the DMHDD SUS IDD team, Ginger Yarborough, who is not with us today, I don't think. She is our Chief Clinical Officer, is always happy to answer any questions that you might have. And my contact information is there as well. Also, always happy to answer any questions that you might have. If there's anything more general or something that you would like to ask or have an agenda item added, you can also use the DMH IDD mailbox, and that address is there as well. And please stay connected with Inclusion Connects. Our QR code is there. All right, next slide. I think we're at the Q&A portion. We are at the Q&A portion. And I do believe that there are some questions that have dropped into the chat. And I think several that, okay. So were these, okay. All right, so is anyone concerned about the heavy reliance on 1959? So that's a great question. And I think it's important to recognize that people's needs in the intellectual and developmental disabilities space are very broad and cover a range of different things. So one of the things that we encourage folks to focus on is not necessarily the IDD portion, since really only the innovations waiver has that as sort of the IDD service. Otherwise, we really do encourage folks to work on identifying people's needs and having their needs met based on whatever services are available to them. We talk a lot about 1959 because that's a relatively new service. It is an entitlement and it's not something that has been available in the past. Folks who have a lot of medical needs might be able to access the CAP-C or CAP-DA services. We also have folks who may be eligible to access PACE services if they're in the elderly space. So we certainly encourage folks to look into what their needs are and look into applying for services based on their needs and not just IDD. What employment options are available to adults with the innovations waiver who are not interested in CIE, given that the waiver, waiver funding is not available for vocational services delivered in facility-based sheltered work settings. I encourage you to reach out to the provider who is providing services for you and talk to them about what type of options are available for a person who is on the waiver and is receiving services, to be able to identify what their options are and what they want for themselves. So we also have a question about, will there be financial penalties for not meeting the contractually required CLS utilization rates? That is somebody who is with more keys than me. That is certainly not my space. So we work very hard. There are a lot of reasons why CLS rates are not necessarily hitting the 85% utilization, and not all of it has to do with direct support staff not being available. So that is certainly a topic and an area that we're working on. It is something that is contractual at this point, but it is not, to my knowledge, that there are penalties. I think it's a greater focus on let's get to where we need to be so people are receiving the services that have been authorized for them. And then will there be an opportunity to true up past CLS utilization data given the known data quality issues? For example, the 365 billing window, yes. And so that is one of the topics that we do have, is that there's a potential billing lag in services. One of the reasons that we chose the community living and supports, and it's specific to the innovation waiver members, is because, and it's also specific to members whose plans expired during the reporting period. So we can certainly go back and take a look at previous data to see if there is an impact with that. Um, and sort of address if we have known data quality issues. And that is something that we have talked about through the implementation of Inclusion Connects, is working very hard to get good, high quality data so that what we're reporting is true and accurate. Okay, I don't see any more questions popping up. Lauren, did I miss anything?
You did a fabulous job, Tina. I have all of the questions have been answered, and I think we've covered all the topics we intended to today.
Okay, great. So again, I encourage you, if there are specific topics that you all would like to hear about, get more information about, please send those topics to us. We're working hard to get information out. And the contact information for the DMH IDD contact and also the recording and presentation slides will be posted on our webpage as well. I don't see anything else, so I am going to hand it back over to Latoya to wrap us up.
Thank you, Tina. The recording and presentation slides for today's event will be posted on the Inclusion Connects website. The link is included in the chat. There will be a brief survey following today's webinar, and we would appreciate your time completing it. The next Inclusion Connects Community Advisory Community meeting will be on Monday, July 20th at 11 o'clock. This concludes our webinar for today. Thank you for attending.